There's a community health center on the west side of Cleveland where family medical care is always centered in the neighborhood. As the only federally qualified health center on the west side, Neighborhood Family Practice provides a high-quality and personal approach to family medical care that is distinctly different from a free clinic or public hospital. And all patients are welcome, regardless of their ability to pay. Here's why Neighborhood Family Practice is a community health center like no other, and a place you need to know about.
A group of committed community members got together with a doctor coming out of the Metro Health system because they realized there was not enough primary care on the west side of Cleveland. Unfortunately, that's something that we still see today.
From its humble beginnings in a small storefront office on Storer Avenue, Neighborhood Family Practice now has 5 community health centers spanning 12 very diverse Cleveland neighborhoods. In addition, Neighborhood Family Practice operates several satellite facilities in partnership with the centers and the Cleveland Metropolitan School District. Over the past 5 years, Neighborhood Family Practice has seen a 38% increase in number of patients served and a 56% increase in patient visits of all types. This phenomenal growth is an incredible story of a group of determined healthcare providers inspired by a profound lack of healthcare in the area.
Our mission is partnering with the community for everyone's best health. I think one of the things that really makes Neighborhood Family Practice such a great organization is we're not trying to duplicate existing services in the neighborhood. We're trying to really understand all the supports that are in our neighborhoods so that we can help our patients take advantage of the good things about the neighborhoods.
How I got acquainted with the Neighborhood Family Practice was from my social service worker from another agency. She had referred me to Neighborhood Family Practice because I wasn't happy with the services I was receiving from my previous primary care physician. Upon becoming acquainted with Neighborhood Family Practice, we scratched the surface and just started from the beginning, and that led to the diagnoses that I now know today, and that probably wouldn't have happened had I stayed with my previous provider.
I actually went for one of my women's appointments with one of the midwives, and she told me about the centering program. I wasn't expecting at the time, but she said in the near future, if I knew someone who could benefit from the program, to tell them about it. And when I was expecting, I was like, okay, I will get a regular open, and I had no clue about what midwifery was. I talked to my husband. I was like, let's give it a chance. We don't lose anything.
Over the course of the first 3 appointments, I was diagnosed with hypertension, and she was able to start treating me for that. Also, she checked my blood sugar, and I found out that I was pre-diabetic. Now, I'd also mentioned that I had a history of being asthmatic, but she went beyond that. She actually referred me out to a pulmonologist, where I learned that I wasn't only just asthmatic, but I also had COPD and exercise-induced asthma.
We got there. It was very welcoming, very warm. All of the midwives were there. They introduced themselves. The nurse was there. The program coordinator was there as well. And they just made everything really comfortable and an open channel for us to talk about different things that a woman goes through.
Our medical home model is a great way of really serving the needs of the community. We're really looking at ourselves as being the hub of the care for a large number of folks in our neighborhoods. Last year we served over 16,000 people, and we're tracking this year to serve 18,000 people and continuing to grow from there in our 5 locations.
In 2014, Neighborhood Family Practice provided more than 8,000 assists to patients and consumers, helping more than 2,200 of them submit applications to the health insurance marketplace, including Ohio Medicaid. As a result of providing this service, NFP has seen a decrease in the number of uninsured patients receiving care.
I haven't had health insurance probably for about 20 years, and it's hard for a small business to pay those premiums. The stock market collapsed and the real estate bubble bust, and it was very, very difficult. Once I got approved for Medicaid, it meant everything. Now I had access to medical care that I never had for the longest time. I had eyeglasses, I got medications, and the medications were paid for, the eyeglasses were paid for.
I was prescribed medication, metformin, to bring my A1C down because my sugar was just going up and going up and going up. But over the course of time, and again with that teamwork effort, what we were able to do is identify some of the areas of where we could make improvements and where I could make changes and implement those changes. And over the course of time, my A1C dropped.
In 2014, Neighborhood Family Practice screened 650 new refugees within 90 days of their arrival in the United States. NFP, a member of the Refugee Services Collaborative of Greater Cleveland, is currently the only provider in Northeast Ohio offering this service. Of those screened, nearly 70% returned for ongoing primary care.
I came to the United States with the help of IOM because I came here as a refugee. I was threatened because I work with the American organization, but within that time I applied for IOM as a refugee because my life was unsafe. And the neighborhood family, they did that job for them, and they do the health care and the insurance for them. They treat the refugee in very good way, and they are very kind, especially with children, and they try to overcome all our problems, even the psychological problems. You know, there is a culture shock between my country and coming here to a new country.
The United States has a higher infant mortality rate than any of the other 27 wealthiest countries, according to a new report from the Centers for Disease Control, and Ohio ranks 5th highest among the 50 states. Even though medical services have expanded, the population of medically underserved residents of Cleveland's near west side has continued to grow. Strategic planning efforts undertaken by Neighborhood Family Practice leadership and the board of directors, more than half of whom are patients, revealed the number of patients could grow to as many as 24,000 patients over the next few years.
The Affordable Care Act pushed some funding out the door to allow community health centers some funding to expand operations. Unfortunately, that funding did not come with any capital dollars. So as we look at the growth and the things that we need to do to innovate and stay current, the ongoing funding for those activities is not supported through our traditional funding streams. But overall, having a patient-centered team is really considered state-of-the-art in primary care. Having a group of folks that are supporting the medical care provider, nurses, as well as other team members in wellness and pharmacy. Those services are not currently reimbursed under our model of care, yet we've found that they are critical to maintaining the health of our community, and we are committed to trying to provide the absolute best care that can be brought to the table so that people can really maintain or regain their health in many cases. One of the things that is very difficult to support with our current model of funding is all of the things that we do to keep patients healthy. We are trying to stand up a model that really looks at health and wellness and prevention, and those are things that are not reimbursed under the traditional model that we see in the healthcare system.
This is the best thing that happened to average people since I don't know when. I'm a baker by profession, but I think my business is mankind, so that's why I'm here right now.
Neighborhood Family Practice is a community health center like no other, where family medical care is always centered in the neighborhood. Thank you.